Hey there team, Oliver from Recharge Physio here, and just wanted to jump on with a quick bit of info regarding low back pain. So a lot of the time we hear patients coming in with low back pain, and they have picked up some advice online or from trainers, or maybe just some alignment advice for doing fitness classes or things like that. And why it's so important to actually get your low back pain assessed by someone who knows about the mechanics of the body is because one type of low back pain can be completely different from another type of low back pain. An example of that would be that, if we've got any compression through the lumbar spine because of a lack of hip extension, then we're going to have pain going into lumbar extension, bending backwards like this, okay? Bending forwards and creating some pelvic tilt and rounding in the spine is actually a good thing to some degree because we want to offload those facet joints and create space in the lumbar spine. However, on the other hand, if you've got a disc problem, creating space in the lumbar spine is going to create an opportunity for that disc to have even more pressure pushed on it, and it could actually make a disc problem worse. So bending forward and rounding forward in the spine is actually not great for a disc problem, and it probably needs a little bit of the opposite. However, with a disc problem, if we just immediately start doing the opposite and going into extension, we could also crush that disc and it might not be happy with it. So it's important to get an accurate diagnosis on how specific the disc injury is, which side it's on. Maybe it's on both, maybe it's on the right a little more than the left, and we need to do a certain amount of left-sided treatment and a certain amount of right-sided treatment. Maybe we need to do some unilateral treatment and then focus it a little bit more on bilateral treatment. So it's really specific to do with your back and how it is, how it's moving, how it's working, and we can form a rehab plan for you that's going to be just right for you and give you advice as to how to manage your movement in the fitness classes so that you're able to rehab your back while you continue to work on classes. Hope that helps. See you in the clinic soon.